Our final speaker in this session is Paula Rieger, who is with the Oncology Nursing Society. We've stressed how important the role of nurses are in all of the settings that we're talking about. So hearing from Paula on the role of oncology nursing in healthcare delivery would be quite helpful. Thank you, Paula.
Thank you very much. I realize that I'm the only thing standing between y'all and your lunch, not always an enviable position, so I'll try to be brief while hitting the main points. I also want to thank Ben and Eduardo and the organizers for inviting me to speak globally about the profession of nursing, and to say a quick thank you to our volunteers who help us in the development of many of our programs, as well as my staff at home. I have one here, Len Mafrica, who heads our international initiatives among the many other things he does. And you'll see a recognition at the end, and I want to not forget to mention Heather Belansky, one of our nurse staff members, as well as Kate Shaughnessy, who've been very active in the development of the programs I'm going to talk about, and who helped me with the presentation of both the slides and the poster materials. So my job this morning is to talk a bit about increasing capacity in the delivery of breast cancer care from the perspective of the profession of nursing, and specifically oncology nursing. So I'm going to try to make 2 points during my talk. One is to talk a little bit about the huge workforce issues within the world with respect to both all healthcare professionals and nursing, and then to end talking a little bit about some of the programs that we have developed at ONS to try to help address this program. It's interesting that we're doing this today because this is actually the 2010 International Year of the Nurse. It's the celebration, the centennial celebration of the death of Florence Nightingale, who was is well recognized for the initiation of the profession of nursing. And there was an event I went to at the National Cathedral in Washington in April that actually celebrated this event. There's a website that actually looks at this, and one of the purposes of this celebration is actually to look at nursing's contributions to the UN Millennial Development Goals. And there's stories on the websites about how nurses all over the world have actually contributed to these goals. So there's no need to belabor the point that there is an estimated shortage worldwide of healthcare workers, nurses, physicians, just to name a few. It is most severe in the poorest countries in the world, especially in sub-Saharan Africa. So in many parts, as we've discussed here at this conference, how the needs are very crucial in those parts of the world. It is a global shortage. Nursing specifically, it impacts both the developed parts of the world, US, Canada, Europe, and the developing nations as well. It's no surprise that the high-income countries actually have the highest ratio of nurses to patients, and as you see here, 8 times more than the low-income countries. Europe actually has one of the highest nurse-patient ratios, 10 times that of some of the other regions in the world. The nursing shortage jeopardizes healthcare in many ways, and it's a very complex situation, but this just reiterates some of the key points on how it can not only impact patient care, but can create very stressful working situations and conditions for nurses. So these are just some of the impacts. I won't necessarily go through all of them. I think some of them are more related to the developed world, but can be extrapolated to some of the difficulties in the developing world. Such as when numbers are low, nurses have to actually cross specialties and do almost everything. But I think the one that's most of concern to this audience is the very bottom one, and that is the issue of nurse migration. And Ben asked me specifically to speak a little bit about that particular issue. So we tried to look at pulling some data on what's known about this particular issue. And it is a critical challenge to the nursing shortage, and as most things in the world with an issue, it is a very complex issue. Primarily occurs in Oceania, Africa, Central America, and the Caribbean. So in the developing world, what you have is an exacerbation of a shortage that is already occurring there in poorer countries because nurses potentially are pulled away to other parts of the world, and so it further weakens their healthcare systems by, in a sense, pulling away some of their best and brightest healthcare workers. So this competition for nurses, where there's intense need for nurses in the developed world, places like America, Europe and so forth, has created this enormous market demand for nurses. And so actually, I learned a lot in preparing for this and reading some of the articles about it, that there's actually big business in many countries on the provision of nurses to the developed world. And in fact, many countries actually produce nurses and healthcare workers for exportation. And one of the largest is the Philippines. Huge numbers of nurses from the Philippines still come and used to come in large numbers to the United States. So what you have is sort of this push-pull of need and demand, and yet what occurs in the developing world is working conditions that sort of contribute to the desire for nurses to leave and look for, in many times, a better life or a better professional life elsewhere. So just to say a little bit about the business of migration and some of the factors that may necessarily contribute to this. When you see the recommendations on how you improve the situation, one of the things is the image of status in nursing in many countries contributes to the migration. So not only does this particular point contribute to some of the problems in the developing world, but it's also a problem in the United States, Europe, and other places in the developed world when you look at trying to put in place strategies that address the shortage. It's how do you get people to want to go into a career of nursing. So that's one way to look at it, and then yet still it remains a problem in other parts of the world. Not so much, it's people then wanting to move to parlay their skills in another part of the world because they feel that the image, status, and acceptance will be better. So this just shows you where some of the major countries in the world actually where they recruit from, and sort of part of those patterns of the business of migration. So what are some of the outcomes? What happens when you have this massive movement of nurses back and forth? You have challenges in places like the United States and Europe where they become reliant on foreign nurses to help address the shortage. It's not something that's heavily promoted, and clearly at ONS we have positions, and many of the nursing organizations, when they look at this issue, really don't see this. This is not a viable solution to the shortage in the developed world, but it is a fact and it occurs, and that's one of those pushing forces of the need to secure nurses in our part of the world. So the shortage in the developed world is of critical proportions, and I won't go into all the numbers, but most of us know from the United States is that we're predicting a huge shortage of healthcare professionals and especially nurses in the coming years. As the population ages and we need more nurses, it's going to become a more intense problem. So measures to resolve these shortages have interfered with the international workforce goals and has resulted in some of this brain drain that people talk about. There's a huge demand for migrant nurses that exceeds the available supply, and it ultimately threatens the public health. So what has been done about this? Not to belabor, it's a very, at times, distressing picture, and the statistics are difficult to look at sometimes. But there are some potential groups out there that are looking at solutions, and what are some of the things that we can do around this? One that is involved, that I don't have a slide on in particular, but is the International Council of Nurses, which has done a lot of work in this area. And these are recommendations from Sigma Theta Tau, which is the National Nursing Honor Society, and they have a series of international recommendations on how to potentially look at this issue and address it. And so, because time is short, I'm going to just focus on one that I think can be one of the most positive. And for those that are in this room, many of you are opinion leaders in your where you live and work on a daily basis. And so how can you personally sort of think about this and address this issue? And so it speaks to how people in a country think about and treat nursing as a discipline. And so you can serve as opinion leaders in trying to reposition nursing in how it's thought of and treated in the country and included in the provision of health care. And so by making nursing a viable partner in the provision of care, and how nurses are thought about and treated and seen within the healthcare system. So sort of that's that second one, in constructing practice environments that are interdisciplinary and then build on the relationships between nurses, physicians, and other in the healthcare profession. Also by looking at how to develop career-enhancing incentives for